You weren't supposed to wake up for the procedure. We're doing a full-on brain scan. I suppose it's okay if you are awake, because everything is connected and is perfectly safe, but I would suggest closing your eyes if you don't mind. We had a little bit of a concern when we were doing a cranial nerve exam, so I had to open up your brain to get a good look at it. I might as well check both sides of the issue while we're taking care of that. Do you feel lightheaded? I only ask because part of your brain is missing. Well, I need to do a full cranial nerve exam, but focus on the cranial part, so if you could twitch for me if I hit a nerve, that would be perfectly acceptable. Alright, just relax yourself, if you don't mind. See if it's any more delicate over here. I'm tracing your nerve patterns here as we provide different stimuli to the medulla oblongata. I'm seeing a little bit of shock analysis here, which means you probably have had some sort of head trauma, or perhaps this dates back farther than your fall. Well, you had told me that you had fallen and couldn't get up, which is why the emergency room transferred you to over here, because we were afraid there was severe head trauma. As I am a specialist, maybe we should just get some scanning in, should we? Alright. Alright, just relax for me. And we're just going to do some scanning. Good. And one more pass, if you don't mind, of course. Good. Actually, wait a moment for the scanning to give us a result that would be worth looking at. So for now, I'm just going to continue to look up in here, and I'm just going to actually focus on the soft tissue of your brain. Let's look into the bottom right here. the soft tissue part of your brain, which typically only takes up about 30%, is a little bit higher for you, and the concern is that it could be an irregular growth. And we don't need a tumor or anything like that, so we're just doing an extra check. Good. Excellent. All right, let's take a look at those scans and see how well everything looks. Interesting. I don't want to pass judgment just yet. Let me just... I see. If you could just relax for me. You're perfectly in safe hands, but again, part of your brain is actually out of your cranium. So, if you could just sit still for me, don't make any sudden movements. This exam is completely eyes closed, as I have told you, so just focus on your breathing and let me just finish up the exam. Good. If you could breathe in for me, that would be perfect. Alright. And just curious, when your brain is opened up, sometimes patients can have adverse reactions, and I mean in the ever so slightest possible way, where your olfactory nerve is a little bit discombobulated. So I'm just curious, do you smell any particular sense at the moment? Coconut, you say? Coconut. Coconut, coconut, coconut. Coconut, coconut, coconut. That's very peculiar. Alright. I see. You're doing well. You're doing well. Just tidying up a few loose ends. Just relax. And let yourself drift off to sleep. Honestly, it's perfectly fine, it's safe, and it would be preferred that you actually don't wake up again until you have your brain in complete and proper order. So, take a couple of deep breaths, hold for 4 seconds, and exhale. That way it'll get your heart rhythm in a good pattern to relax the portion of your brain that we have left operative for basic bodily functions. If you could just sit still for me, don't try to talk. Yes, just it's time to put your brain back together. It's like Humpty Dumpty. You'll be whole again. But you won't be falling down on my watch. Do you want? Doing good. Now that we have your brain directly poised over your noggin, just stitch it back up into place. Stitch it back up into place. Do you still smell coconut, coconut, coconut? Good. That's a little bit irregular. Alright. You're doing absolutely just as you should. Checking your vitals on the machine. We have to make sure that the brain is fully functioning after an ordeal like that. No tumor, which is excellent news. So this could just be a formality of actually falling down. Alright, your neck seems to be perfectly normal. There's no spinal damage. We always have to check that when we reconnect the brain, that the spinal cord doesn't get out of whack.